So I want to do a follow-up for you guys. You have been asking me some questions. It's been 5 months since my deep plane facelift, my neck lift, and my fat transfer. Now, I have a little cold, so just bear with me because I wanted to get this up for you. So I want to talk about, if I'm happy with what I've had done, if I would recommend doing this, earlier. So I was 49 when I had it done, right before I turned 50. What any complications that I'm having, and things that have been going on. So I know a lot of other people don't continually post videos once they do surgeries. And when I was looking and researching for my surgery, I wanted more information about what goes on after. So my goal is to continue to provide these videos to you so you can have information whether you're looking to have this done and just curious, or if you've recently had a facelift and you want to know kind of what maybe will be coming up for you, what you can look out for. Now that I'm 5 months in, so my surgery was February, so 5 months in, things that I've noticed is that I'm still numb. So not as numb, it's better, still, week to week, it gets better, but I'm still numb around my incisions. And for my scars, I haven't been using any scar creams yet. I mostly am just massaging with, whatever serums or cream I'm putting on my face, and then I'll bring it around, and then I will massage morning and night my scars just to help them flatten out. That's what I've been doing. So I have been having, I guess, some pain. So I notice I have pain like along my jawline. So it's not all the time, it's very sporadic, but it's almost like if you've ever had another surgery and you're healing, it's like everything, I guess, is like reattaching, I don't know, connecting. So you get like a little achy. So, I'm just super aware of my body. So it might not be something that you even notice that much, but I do notice sometimes in the morning, I feel like a little bit achy, but I don't have to take Tylenol or anything. It's, manageable within an hour or so. It's usually gone, but I still do. It's not like I wake up and I don't know like that I had a surgery. So I feel like that a lot. I feel like sometimes you forget that you had it, and then you get these like little twings or something like around your incisions. They start to feel tight for me at the end of the day, um, like a little bit uncomfortable, but nothing like that I regret having the procedure or anything. But these are just things that have come up for me that, maybe you can be aware of so that if you go through it, someone else has experienced the same thing. So next month I am having another surgery. I'm having my breast implant is ruptured, so they're 22 years old. So while he is swapping out my breast implants, I'm having more fat done because my fat hasn't really taken. And you can see every video I try and show you, but here I have this like little line. So the plumping that he did in my cheek, really isn't staying. So I do have a problem with filler lasting in my body. And he said I'd probably have a problem with fat lasting in my body. So that has been the case. So I'm doing another fat transfer next month, and I will video that for you. But I have watched other videos of other plastic surgeons talking about fat transfers. And what they say is, and a lot of people are not happy with the fat. One, it takes longer for your face to heal if you do the fat transfer at the same time as your facelift. Okay, so know that. So definitely I was swollen longer. All the nurses said it takes longer. So that is one issue when you have the fat done at the same time as your facelift. But what these other doctors were saying is a lot of times they put the fat in and you're swollen, right? You're swollen because you have fat and because you have the trauma of putting the fat in and the trauma of the surgery. And then it's almost like the fat dissipates and you feel completely flat. And then I guess then your body recognizes the fat and creates like a blood flow back to the fat, and then your face plumps back up. So I have noticed that honestly, where I feel like plump and then flat and then plump again. So I don't know if that's just like actually a thing that these plastic surgeons were talking about. So a lot of people have issues with fat for that reason, because, you can look different from month to month until I guess it settles in and the blood flow really develops to that area. So just something to keep in mind. So as far as exercise, I'm pretty much back to like my old workout routines. I do still notice if you're going to do any kind of like sit-ups, I still notice it doesn't feel like before the surgery. You're going to feel like some kind of little pulling. So I do try not to do anything where you feel that pulling sensation. So I guess I'm not like 100% back to where I was prior to the surgery. Now, another thing to consider, now I know men watch these videos as well and have asked me things and commented, but I now am officially like in menopause. So I'm 50, and a lot of women are getting this surgery even earlier than me than, I was at 49. And so a lot of women may be getting this facelift and they're still like regular on their periods. Okay. Now, when you hit menopause and your estrogen completely drops, okay, studies show that in the 5 years post menopause, that you lose like 30% of your collagen and then 1% every year thereafter. So maybe waiting until even later than I did it would be more beneficial, because then you're going to have more of a realistic look of how your face is going to look, because you're going to be so depleted in your collagen. Now I'm going to start really depleting in my collagen. So maybe that's going to mean I'm going to need more tweaks or more fat, or I don't know. I mean, I do facials for a living. So it's like my area of like where I study, and I'm obsessed and have done treatments since my 20s and will continue to do treatments. So that's what I want to talk to you about, is once you get your face done, make sure, and even men, I researched a little bit for you, as your testosterone drops, you also lose collagen, lose bone, the same that women do, right? So we're losing collagen and we're losing bone. And as we lose bone in our face, we lose the structure of our face falls, right? So now if we're getting the facelift to pull us back up, but now we're continuing to age at a faster rate. It's just something to really keep in mind, because we really age at a faster rate, and men as well. Once we hit 50, it's like a fast decline. And if we're getting our facelifts now in our 40s or early 50s, like how is that going to impact us as we continue to age? So I guess that's something that we're going to figure out together, since this is a trend to be getting our facelifts earlier. Okay, so then if we're getting our facelifts earlier, I just want to make sure that you're continuing, because obviously you care what you look like, to do treatments. So keep up your home care and your supplementation. So you're going to need more collagen supplement, more protein, higher protein diets, more weight training to keep the muscle that you have and your skin integrity. Okay, so keep your diet like really in check, and take collagen supplements, vitamin C supplements, and zinc. So zinc and vitamin C orally has been shown to be a precursor to helping create collagen. So just something to keep in mind as you're looking at your supplements. And obviously, fish oil, some type of fish oil, krill oil, high omegas are really important, even post recovery. There's a lot of data in having high omegas in helping in wound healing. So I did increase my omegas and my proteins and my antioxidant vitamins post surgery to aid in like healing DNA faster. Okay. So treatments that you might want to consider once you get your facelift after to maintain your collagen, would be peels, lighter laser treatments once in a while. I would, really watch out for the RF microneedling Morpheus devices and the HIFU. Now I have them here. We do them in my practice and in my friends' med spas, but there's more and more data stating like done too often or too high a level can decrease your fat pads. And that's the last thing that we want to do. So I kind of steer clear of RF microneedling and HIFU treatments for myself and for patients that are, in our 40 and 50 age range, maybe like once every 6 months and at a lower setting. So I use microneedling more for helping for product penetration, but not to induce collagen. So those are things that you want to research and talk to your estheticians and your, doctors about as far as treatments. I think that fat transfers and your own, stem cells are fine. I would really research exosomes. So I'm not offering exosome treatments to my clients because they're very new and, they come from donors. And now with the state of the world and people being vaccinated and not vaccinated, and your thoughts on that regardless, I don't really want someone else's DNA put into my body until there's more studies on it. So I'd rather take my own fat and take my own stem cells and put them in, as opposed to using donor. So also do your research on that. It's becoming a big controversy even with my clients that have babies, and if they're in the NICU, and I've had babies in the NICU, and they give you donor breast milk, and now it's like, did the donor have a vaccine or not? So anyway, it's just something to consider as you are going down this anti-aging route, and what you are putting on your body, on your skin, because it's being absorbed systemically. So just something to think about. So I want to talk about follow-ups with your doctor and, how you're healing, and if you want to have any tweaks done. And, most doctors, I think, will wait up to a year to do any type of revisions. So I have noticed that my bands, and sometimes in my videos, you can tell, are still popping through. And that was like a big concern of mine, because I'm thinner and, more lean, and my platysmal bands were a big issue for me. So I don't know because I'm still a little bit swollen here. It's harder to tell in the videos, but I'm still a little bit swollen. So I don't know if that's causing like a pulling of my bands as I talk and you can see them more, or if they weren't pulled tight enough. I don't know. Um, so that's one area that I'm watching and monitoring to see if it's something that I need to have revised. And then another thing is, and this is a hard area to address from what I'm learning from other doctors, is this area here. So like when people pull, your face and like I'm pretty tight, like there's not a lot more like he could pull. There's still this area that a lot of people struggle with. And I've heard other doctors talk about it as well. So I will talk to him to see if there's anything, maybe like when he gives me more volume with the fat, like it will help in this downturning of the mouth. Now, something else I notice when I talk, and most people probably aren't going to notice this because you're not like filming videos, but I notice when I talk a little bit, my mouth comes down. And what I think is, um, I think I'm still healing from the neck. So I watched this one reality show where this younger girl had only her neck done because she's a little bit overweight. So she had like lipo here and her neck tightened. And I followed her this show for years. Okay. So now, and she's like 23 years old. When she talks, since she's had her neck done, her mouth completely turns down. So I think it's the pulling of the swelling, okay, that's pulling the mouth down. So I've noticed it's getting better over time, and I'm sure like with her, it's going to get better over time as everything, all the swelling subsides and everything kind of relaxes. So that's just something for people that are like really noticing a lot, or you're talking, or maybe, you're filming yourself as well, and your mouth is pulling down a little bit. I never had that before the surgery, and I can gather it's from the neck situation. So that's one other thing to take note of, but most people probably will not, be aware of that because you're not talking on camera. So that's about it. So that's like my 5-month check-in. I'm still happy with the results. I'm happy that I did the surgery. And I still get comments from a lot of people that I shouldn't have wasted my money, or I look pretty much the same as I did before. But I'm happy. And I want you guys also to, not really listen to the people that are going to say these things to you. If it's something that you really want, do it. Don't read like the negative comments down below. I don't know why people choose to watch these videos and they're anti-plastic surgery, watch my whole video and then comment on it. Like, why waste your time if you don't believe in plastic surgery? Like, just move on. So don't be discouraged. If you're happy with the results and it's something that you want to do that's going to make you feel better, then just do it. If you are healing, just know that you need to be patient. If you're early on in your healing process, like it's very hard in the beginning. And a lot of people message me and they don't realize how hard it's going to be. So worst case, imagine it's going to be really, really hard. So then maybe you're pleasantly surprised. So I've had younger women than me message me and just really getting discouraged because it takes time to heal and everybody heals completely differently. And when you're watching some other doctors online that post their patients and they're very looking amazing and healed after 7 to 10 days, and you look like a disaster and a monster and you don't want to leave your house, no, that's totally normal. And most people feel that way. And I felt that way. And you guys probably saw my video. I looked crazy and I have young kids and, they had to deal with me looking crazy. So just, have a positive mindset. Okay. Just be as healthy as you can. Eat a lot of healthy foods, try and get up and walk. Blood flow is really good. And don't get down as you're looking at yourself and analyzing every little thing, because I know I've done that as well. And you look at even like this little thing, like people think I'm crazy, but if you are in it and you're getting surgery and you're spending all the money, you want to, look as good as you can and you have expectations. And I understand. So if you are feeling frustrated and you need someone to talk to and nobody understands because they haven't been through it, then just message me on Instagram or message me down below. I pretty much will message everyone back because I just don't want you struggling. If it's something that you really want to do, if you're struggling because nobody understands what you are going to do or what you've done, and you're feeling like, you have regrets or whatever, just message me and just know that you're not alone. And I'll continue to make these videos for you. And I hope that they help you, and good luck on your journeys. It's going to be amazing.